Today, I am so honored to introduce you to Dr. Jean Watson, who is the founder of the Watson Caring Science Institute. And we are going to get into a dialogue that I really believe you are going to benefit from and really enjoy. So, Dr. Watson, how are you?
I'm wonderful, and it's lovely to have this time with you, Simon.
So glad that you have made yourself available. Here's the question for you. When we think of caring science, the caring science journey, how does caring science hold the discipline profession of nursing to care holistically for patients and families? How would you answer that?
Well, this has evolved over time, but the roots of nursing are back to Nightingale, and she already was a mystic and a scientist and a scholar and a visionary and a healer at many levels. And so somewhere along the way, nursing got detoured from its fullness of its own development as its own unique profession. And in the last 30 to 40 years, we have begun to really reclaim the foundation of nursing and its relationship to humanity. And my work started, my first book was written back in 1979 after getting my PhD, because I was realizing that our science model, the Western model of science that nursing was adopting in academics and in clinical setting, was one of really Western science of separation that distanced us, that gave us to a clinical perspective and a professionalization that distanced us from our humanity and from the patients. And so, and it was also lacking in a meaningful philosophical foundation. So the origins of my work came from those grassroots of realizing that nursing had something to offer to humanity that transcended the system, transcended diagnosis and treatment, even transcended age or setting, which is really about our humanity. It comes for nursing, but it's really for humanity. And because of that, I have continually evolved to where I have developed what it's referred to now as the universals of human caring. These are 10 Caritas processes that have informed the development of my work. However, these Caritas processes are located within a new model of science. There's a new philosophy of science that informs caring and our humanity. And it has to do with what I'm now framing as caring science or unitary caring science, because it captures the unity of our humanity. It captures this quantum universe that we're in, and we are required to advance and evolve in our humanity, in our consciousness, to realize that I'm connected with you, you're connected with me, what I'm doing to myself, I'm doing to others. And so it really is a pause, a reflection. It's a philosophical value grounding that requires personal as well as professional development in order to move from doing and separating and just busy task to actually being. What does it mean to be a nurse? What does it mean to be present? What does it mean to be authentic? What does it mean to pause, to listen authentically to that other person's story, to hold sacred space where they can hear themselves even when we're so busy? So these concrete micro practices are informed by an evolved model of science. It allows for the metaphysics as well as the concrete physical realities. It brings in the spiritual. It honors our own spirit and our own emotions, our subjective world, not just the objective. Mm-hmm. And it brings meaning and helps us transcend the despair. There's this quote from Viktor Frankl. He says the roots of despair are the lack of meaning in our lives. And so the search for meaning and purpose, even in the midst of suffering, these transcend all of our humanity across the globe. And caring science and the 10 Caritas processes are one entree into how do we cope? How do we find meaning? How do we evolve in our consciousness of humanity? How do we reach out and realize that we're touching, and we never know how we're touching the life of another human being. And when we're touching them, they are touching us. So all of this is part of the evolution of nursing, but it's also the evolution of a broader model of science that transcends medical clinical science.
Wow. Dr. Watson, what prevents systems from embracing caring science and this research that you have focused on for the last 40 plus years? What prohibits systems from really evolving and moving forward?
Consciousness, consciousness, consciousness. Unless the leaders have a vision, a value system that's able to live out at a higher level of consciousness that holds our humanity and the importance of the human aspects in the system, we are back into this control, these scripts, these artificial impositions that try to get people to conform to some kind of category or some kind of intervention that is there to serve the system rather than the people in it. So therefore, you have this really disconnection between the heart of our humanity and the heart of a profession, of the heart of a health professional who is there to offer this healing and helping other persons to find meaning, to be in right relation, to discover how they are able to cope even in the midst of pain and suffering and come up with a new reconciliation of being in the world. All of this is very different dynamic, and yet the systems are constructed around a very hard-edged science model of objectivity and control and outcomes that are designed to serve the administrators rather than the people in the system. And now we're all waking up. The pandemic has awakened us to this reality that we cannot survive as humans or as a planet. And we certainly cannot survive as healthcare systems the way they have been constructed. Nurses are leaving. They're leaving the profession. And one of the reasons they're leaving the profession is because this buildup of the oppression of the institutional controls over the heart of the human caring that nurses are brought to bear, the reason they're there, that dissonance is no longer being tolerated. And so nurses are either leaving, or the ones that are staying are more determined than ever to give voice and language and informed action to help transform the system and the self from inside out. And that's what my work is about. Is really devotion. I've been devoted to really advancing nursing in its fullness as a caring, healing, and health profession, not just a technical, skill-driven, robotic practice model that the systems have tried to impose upon the professional.
One of the things you talk about in your work, and there are leaders that are listening to us right now, you talk about the power of being, belonging, and becoming.
Yes.
What would you say to leaders listening to us right now who are wanting to embrace this approach to being, becoming, belonging? How do they start?
They start with self. The self of the leader has to undergo a transformation because they have to discover their own power and their own strength and their own authenticity and who they are. And from that place, they also need to cultivate a higher consciousness and language of this phenomenon of our humanity. One of the reasons we are having such a gap is that we have not had a language of the phenomenon of human caring. How do we look at outcomes when you don't even have a language? And in this postmodern era, if you don't have a language of a phenomenon of human caring and healing and health and wholeness for humanity, well, we're just going to succumb to the traditional mindset of just controlling people, and also really reducing people to the moral status of objects. Do you know what we have created in our dominant system is we've taken a whole human being. In the first instance, they're a patient, and then the patient gets reduced to body physical. And then body physical gets reduced to machines and technology, as well as the controls in the system. And when that happens, we've taken a whole human being and we have reduced them down to the moral status of an object. And that's very dangerous, because as soon as you reduce another to the moral status of object, you can justify doing something to others' object. you would never do to a fully functioning person like yourself. So
Mm.
that brings us to this deeper ethic, the ethic of being human, of being in right relation with self and other in those moments. I talk about transpersonal moments. These moments transcend time, space, and physicality. All we have are moments, and our ways of being in those moments allow for something new to happen, particularly when we're able to hold that moment and have that spirit to spirit connection and really authentically hear that other person and see that other person. Every person in the world needs to be seen.
Mm.
Every person in the world needs to be heard. Every person in the world needs to know that they matter and what they have to say matters and that they have love. And carrying my work of caritas, I've used the word caritas because I use it intentionally, the Latin word to bring love back into our life and back into our world and back into our practices. So this caritas is a way of being, and the consciousness, caritas consciousness, we hold that in our hearts in these caring moments. We pause and we're authentically present. Something new can happen in that moment. Little miracles begin to happen. So that is the being of the person. And then the beginning and the being and the evolving of becoming more fully human, becoming more alive, more light, bringing more light into the humanity. And when we have these higher vibration feelings of compassion, of caring, of love, of forgiveness, of grace and beauty, I mean, these are really higher vibration feelings that come from our heart of our humanity. When you have that consciousness, you're changing the vibrational field of everybody around you. So you're literally, as a human with this consciousness, you are repatterning the field of that dominant biocytic institution by your presence, by your humanity. And when that radiates out to the whole, you have this ethic of belonging. The ethic of belonging, I use the work of the French philosopher Emmanuel Levinas, and he informs my work in carrying science because he says the ethic of belonging is the first principle of science. See, the ethic of separation, or the value or the neutrality of the separation, is the foundation of Western science. But when you move up to a higher vibration, allowing science to evolve to a higher level, the ethic of belonging, but it's the belonging to this infinite field of universal cosmic love. We all come from love, we all return to love, and it's that sacred circle of life and death to which we all belong. And so this is an awakening for our humanity right now. It's a crisis and a crossroads. We cannot survive as humans or the planet in the dominant paradigm that's imposed upon us today, and we see that. We're all experiencing it, but we don't necessarily have the insight or the vision or the framework to which we can hold something greater that becomes this cosmology of love instead of the cosmology of hate and anger and fear that we've been operating under.
Wow. So for someone listening to us right now, do you have any examples of systems that have embraced the Caritas processes and they are getting transformational, or as you would say, that transpersonal result? Any healthcare systems that really get this at the core that you could share?
Yes. I'll just say as a beginning for any of the systems that I'll give examples from, this work provides a full circle of knowledge. It links the values and the mission of the organization with a deep philosophy and an ethic, a theory, the language of the processes of the phenomena into concrete micro and macro practices, as well as outcomes. So the hospitals that are affiliates of Watson Caring Science Institute that are really systematically delving deeper, authentically into this work and transforming self and system inside out are examples like Stanford Healthcare, Kaiser Permanente, Northern California, Cedar Sinai in Los Angeles, St. John Providence in Detroit, Michigan. We now have a new set of affiliates in the veteran administration hospitals. Just yesterday, I met with 17 leaders of the South Central VA VISN, which is called the Original Vision VA system, where they are now an affiliate, systematically creating very concrete programs where nurses are actually using the language of the CARITAS processes. They are sharing their caring moments and documenting caring moments. They are using aesthetics and art and other ways of knowing, not just empirical knowing, to reveal these phenomena, these expressive phenomena of the heart of nursing and the beauty of our practices. They are engaged in helping each other with very micro practices before they enter the patient's room, to pause, to walk more slowly, to fall into their heart center and radiate compassion for themselves before they enter that room for the patient. You talk about holistic care. You seek to see under this consciousness, who is that spirit-filled person behind the disease, behind the diagnosis, behind the patient who, like, please see me, please hear me. Don't just treat me like a patient. I'm a human being here with all of this trauma and distress and fear and anxiety, and the nurse holds that higher vibration consciousness. She or he can literally repattern the field in their presence in those moments, and it opens up space where the patient can be heard and they can actually find new meaning. And so this becomes a practice of healing, the way in which the nurse touches someone, not just physically, but even non-physically, their presence touches. So there's a whole range of practices that nurses are engaged in to really live this out and show outcomes. So we now have national research on 5 of the CARITAS processes, and I'll just share what these items are because they're quite fascinating. It's quite revolutionary. We're asking patients, because it's consistent with the theory and the philosophy and the values, was your care delivered with loving kindness? It's the first CARITAS process for self and others. Did you have a trusting relationship with your practitioner? Were your basic needs met with dignity? Did you experience a healing environment? And were your values and beliefs honored? So we have been now working with Press Ganey and some other major companies that are looking at outcomes in hospitals, realizing that this is the only measure hospitals have of the authentic patient's experience of caring. So it's very important now to keep this momentum going and participate in the full circle of knowledge for outcomes, because otherwise the outcome research in hospitals has been, the food and, the whole room and the climate and all that sort of thing. But we're finding that these variables become really statistically significantly important in terms of the patient's experience of caring. And in one of the studies, we actually had a hospital with a significant number, not statistically significant, but significant number of patients who said they never had a caring experience or a loving kindness experience.
Wow.
By anybody. And now that wakes us up. You have to really pay attention to that broader system and those institutional controls, or what are they doing? And now we have hospitals that are affiliates with us where they're actually using, we have a measure of those same variables for the culture. And one of them is the healing environment. And now hospitals are starting to use the healing environment to put pressure back on the administrators, because they have a responsibility to create a caring healing environment if we're a healthcare system for the practitioners as well as for the patients. So this too is like upside down. And this new awakening and another evolved consciousness, nurse leaders are starting to critique these old paradigms of such as nurse retention and just kind of keep nurses as objects in this industrial product line system that we've created. We have to interrupt that and repattern and create a whole new, entirely new approaches. And nurses know how to do this.
Wow.
Nurses are leaders in this whole transformation.
So good. Last question for you. Someone listening to us right now, they want to follow your work. Where should they go online to follow your work? And for those leaders that are saying, we need this in our system and in our organization, where should they go?
Thank you, Simon. You can go to watsoncaring.science.org, or you can reach out to me directly. I'm pretty good at responding to emails, people tell me. Jean, Jean, at watsoncaring.science.org. So it'd be my pleasure to provide more information, and we will have new information on this affiliate program, as well as other programs that we have multiple options for people to really go deeper into this work, personally and professionally.
Dr. Jean Watson, thank you so much. We can't wait to hear more. Thank you.
Bless you. Thank you so much, Simon. We'll stay in touch.